Hello friends, myself Dr. Love Krishna Pal Singh Rathod, Assistant Professor, Shalya Tantra. Today's topic of discussion is MRI, magnetic. Radio waves to look at organs and structure inside your body. Healthcare personal use MRI scans to diagnose a variety of conditions from torn ligament to tumors. MRIs are very useful for examining the brain and spinal cord. First, we just see the little bit introductory history. Peter Mansfield and Paul Lauterbach developed MRI-related techniques like the echo-planar imaging technique. They both are awarded Nobel Prize in Physiology or Medicine for the discoveries concerning magnetic resonance imaging. It is non-invasive, painless procedure. Raymond Damadian created the first MRI full-body scanner, which he nicknamed the Indomitable. The scanner itself typically resembles a large tube with a table in the middle, allowing the patient to slide in. An MRI differs from CT scans and X-rays as it does not use potentially harmful ionizing radiations. Uses of MRI. This is the most important thing which we all have to know. The development of MRI scan represent a huge milestone for the medical world. Doctors, scientists and researchers are now able to examine inside of the human body in high details using a non-invasive tool. Following are example: anomalies of the brain and spinal cord, tumor, cyst and other anomalies in various parts of the body, breast cancer, screening for women who face a high risk of breast cancer, injuries or abnormalities of the joint such as the back and knee, certain type of heart problem, disease of liver, disease of other abdominal organ, the evolution of pelvic pain in women with causes including fibroids and endometriosis, suspected uterine anomalies in women undergoing evaluation for infertility, investigation of choice in preoperative staging of rectal and prostate cancer, also used in guided stereotactic surgery and radiosurgery for treatment of intracranial tumor, AV malformation, can be used for diagnostic imaging of systemic muscle disease, MRCP, magnetic resonance cholangiopancreatography. Magnetic resonance angiography generate pictures of arteries to evaluate them for stenosis or aneurysm. Sometimes contrast agent may used. IV or oral or intraarticular. Commonly used IV contrast agent is chelate of gadolinium. New agent invented gadoxetate. What is the principle of MRI? It is based on principle that When these nuclei are subjected to a strong magnetic field, they release some energy in the form of radio signal. These radio signals are converted into images. Hydrogen nuclei are particularly suitable because they have a single proton and neutron in nucleus and also abundant in human body in the form of water. 70% of total body weight is water only. Procedure. The tissue to be imaged is subjected to a strong magnetic field. The instrument is equipped with a high power magnet which can produce a strong magnetic field. When the body is subjected to this magnetic field, the hydrogen nuclei which are present in the tissue tend to align themselves along the line of force of the field from the random position because they also have a small magnetic field around them. To get the image of the particular tissue, the tissue nuclei should be stimulated. To do so, a strong magnetic pulse is applied. The magnetic pulse is the high power magnetic energy released by the instrument. Then the proton present in the tissue absorb the energy and are excited. When they are excited, they release some energy. That energy is received by the detector in the instrument. After releasing the energy, the protons come back to the normal state when the stimulating pulse is stopped. The energy released by exciting proton is called as radio signals. The image is based on these radio signals produced by the tissues. Most MRI scans take 20 to 60 minutes and patient will experience no discomfort. They will however hear a loud knocking or tapping sound when the scanner is actually acquiring information. Operator give them earbud at that time. Don't be panic at that time. Don't move at that time. Be in still position. Advantages of MRI. It do not have ionizing radiation, so it is said to be safe. It gives high intrinsic support. It gives high intrinsic contrast. In any plane, the image can be taken without changing patient position. No known biological hazard. Now disadvantage. Imaging time is long. Totally operator dependent technique. Extremely expensive. Patient with pacemaker and any other metal implant cannot be scanned. This is the point which is very important. Now this is the picture of MRI. Patient is going in the MRI machine. This is the picture of normal anatomy of brain. These are also the other images of brain. Okay. Gastric tumor mass and ovarian tumor mass is present in this slide. Normal anatomy at the level of second lumbar vertebral body. This is the splenic laceration with hemoperitoneum secondary to blunt abdominal trauma. Renal injury secondary to blunt abdominal trauma. A moderate amount of perinephric hemorrhage is present. Normal image of pancreatic level, and in this image pancreatitis is shown. Pancreatitis